Hey everyone, this is Jon Russell. I'm a thyroid and parathyroid surgeon at the Russell Center for Endocrine Health. The goal of this conversation and every conversation is to give patients information from a real doctor who works at some and has worked at some of the best institutions in North America, so that you have all the information to make the best decisions for you about how to treat your thyroid or parathyroid problem. So who am I and why do I feel like I can talk to you about this? I'm Jon Russell. I started the Russell Center for Endocrine Health. My background, I originally I trained at the Cleveland Clinic and then Johns Hopkins, and then I was faculty and the director of the Johns Hopkins Thyroid Tumor Center for 5+ years. I worked at Hopkins for about 10 years until 2024 when I left and started the Russell Center for Endocrine Health. The purpose of this first podcast is to let you know a little bit about me and what my background is and why I did that. And then in the future podcast, we'll kind of go into a little bit more about specific areas of thyroid and parathyroid care and how they can help you and how you can use this information so that you can talk to your doctor appropriately before you have surgery. If you maybe sometimes will even convince you that you don't need to have surgery and that there's another option for you. Or if you're on the fence about having surgery, it might convince you that yes, surgery is the right thing for you, and then help you find the right surgeon to do your job. And to really help you out with that so that you get the best outcome. Oh, briefly, a little bit more about me. I'm actually the oldest of 10 kids. I grew up in a small rural town in Arizona. Thatcher actually was a big part of it. And then my parents moved to the big city of Gilbert, Arizona when I was just about to start high school. Grew up there. Went to Arizona State University, didn't even hear about MIT until I remember, I think I was 22 years old when the first time I learned about MIT. Very, very small town boy. Eventually decided that I wanted to do medicine and fell in love with the idea of being a cardiologist. And back then, without knowing anything more about how to get through medical school, I said, well, the Cleveland Clinic seems to be a good place for cardiology, so why don't I go to the medical school that feeds the Cleveland Clinic, which back then was Case Western Reserve University School of Medicine. Since then, Cleveland Clinic has collaborated with Case to develop their own medical school. But back then, it was just one medical school, so I went to Case and then found out that that's not actually how medical school and residency training works. For those of you who don't know, you start off, you do your undergrad in North America, you do undergraduate degree, and then you go on from there to do medical school. You apply to get into medical school. It's a very selective process. And then after that, you also have another selective process, which gets you into residency. And residency for a surgeon is usually about 5 years, and then you can do a fellowship after that. So turns out I did not love cardiology as much as I thought I would. And instead I fell in love with surgery and was able to watch a thyroid surgery. Was the first surgery that I ever watched happen. And that was done by Dr. Mira Milas. And she left Cleveland Clinic and she's actually at Banner in Mesa, Arizona right now. But I've just fell in love with thyroid surgery. It's beautiful. It's elegant. Dr. Milas is a fantastic surgeon. It was enough to inspire me to change my whole life and reroute into surgery. And then I had a choice because there's two different types of surgeons who usually do thyroid surgery. There are surgeons who are general surgeons who do thyroid surgery. They do an extra year of training in thyroid specific. And then there are head and neck surgeons who do thyroid surgery, or ENTs who do thyroid surgery, and they often will do an extra year of training in head and neck cancer. And as I kind of looked around the country to see what was best, it seemed to me to be a silly idea to spend my 5 years of general surgery training, spending all of my surgery in the belly, if I knew that I wanted to do neck surgery at the end. And so I chose to do ENT training because that was almost all doing surgery in either the neck or somewhere up a little bit closer to the thyroid, since I knew that's what I wanted to do in the end. At the end of that training, I chose to do an extra year of training as a fellow, which means after year 5, I did year 6. And for that, I went to Johns Hopkins and trained. At the Cleveland Clinic, I had some really great, fantastic mentors. Joe Scharf was there. Brian Berkey was there. A couple of great big names in the field of thyroid surgery and head and neck cancer. And then from there, went to Johns Hopkins and trained with Dr. Ralph Tufano and Dr. Martha Zeiger. Fantastic, real luminaries in the whole field of thyroid and parathyroid surgery. Johns Hopkins is where some of the first and safest thyroid surgeries in North America happened with William Henry Halsted. And so it was just a huge honor to train there and then be hired there as a faculty, knowing kind of the heritage of the surgeons who had gone before me and who had worked in those ORs. And just, I remember the first time I operated at Johns Hopkins, just being so humbled as I walked into the room and the patient went to sleep, and you put the scalpel up to the neck to do the surgery, and just, overcome with just the sense of humility of the just giants in the field that I was able to follow as I did surgery in that venue. While I was there, I started to do transoral thyroid surgery, and I was fortunate to go train in Thailand with Angun Anuwang, who was really the first person to popularize scarless transoral thyroid surgery around the world. Spent some time with him. Also spent some time in South Korea with Hunyup Kim, who's the highest volume robotic transoral thyroid surgeon in the entire world. And so was able to learn from them and decide what technique and how I wanted to do that. And was very fortunate at Hopkins to just encounter this environment where I was encouraged to really develop those procedures at Johns Hopkins. And so built up the largest scarless transoral program in the Americas, and actually in the West, while I was at Johns Hopkins. Also, in addition to doing that, was able to do just lots of research to decide whether or not that was a good approach. Johns Hopkins does medical research better than anyone in the world, as far as I'm concerned. And so just had really fantastic resources to be able to dig into that and to be able to learn and help all of our patients with whether or not transoral surgery was a good idea for them. In addition to that, started to do other procedures such as parathyroid autofluorescence and radiofrequency ablation. And in addition to being the first surgeon in North America to treat thyroid cancer with a transoral approach, was also the first surgeon in North America to use radiofrequency ablation for thyroid cancer. And so my practice has always just been thyroid and parathyroid surgery. Every once in a while, there will be another endocrine tumor in the neck, such as a carotid body tumor or something like that I'll do. But just neck surgery, all the time. That's what I do. Or neck procedures, I should say, because I also do thyroid biopsies and things like that. So I guess I should tell you that when I'm talking to you about thyroid and parathyroid care, I've got more than a decade of only doing that after training at some of the best institutions in the entire world in those specialties. So hopefully when you're listening to this, you're getting information that's valuable and that it's current, and hopefully you're hearing a lot of different ideas that you maybe would be able to apply to yourself. Part of what inspired me was in 2024, I actually left Johns Hopkins, and I was just so incredibly busy. My waiting list was close to a year at that point. I realized that I was so busy with the everyday routine of what I was doing that if I really wanted to change how thyroid care was being delivered, I needed more space in my life to be able to do that. I needed the ability to reach out to patients who I was not just operating on right then, but I needed to be able to interact and engage with them in a different fashion and increase the ability to broadcast information and let patients know. One of the things that's really challenging as a surgeon is when you have a good idea and you're trying to encourage other surgeons to adopt that really good idea, other surgeons are pretty resistant to adaptation. And the reason for that is it's really hard to learn new techniques outside of training, and it's really scary. And so as I was trying to tell other surgeons, hey, radiofrequency ablation is a great idea and it really helps patients, and transoral thyroid surgery, it's a really great idea and it really helps patients, the barriers for entry for those techniques were very high. And I realized that if I want to actually drive change and help patients to get the best care, I might need to enlist patients and inform patients so that they understand what the opportunities are and that they can then go back to talk to their surgeons about these opportunities. So you are helping me as you talk to your surgeons and say, hey, what about these other opportunities? What about these other things? So hopefully some of the information that we give you will be valuable. It's all going to be evidence-based. As I've had more time away since leaving Johns Hopkins in August of 2024, I've had more time to get into the online world of what patients are saying and to learn and understand from patients in an online forum. And there was a comment that was made that, boy, why are all of the thyroid influencers, why are none of them doctors? Why are they all PharmDs or PAs or other people? Why isn't there like a real dedicated thyroidologist who's an influencer in this field? And partly it's because those PAs and those NPs and PharmDs, they're probably more talented at creating content than at least I am. So that's the first part. So hopefully you'll bear with me as I learn how to create some content. But part of it is that doctors are just really busy. To get in to see a good thyroid doctor, it's going to take you at least 6 months to do it. And so creating space in our lives so that we can create content and we can inform patients, that's hard for a lot of us to do. So in my current situation, I've started the Russell Center for Endocrine Health. We're based in between DC and Baltimore, Maryland, in Columbia, Maryland. I still actually operate and do surgery at Johns Hopkins Hospital, but I'm completely independent from them other than that. And so the goal of this podcast is to give you as a patient information that is totally up to date and includes all of the different scientific resources that you might use when you go in and you consider how you should treat your thyroid or parathyroid problem. And so we'll delve into all of these different things. We're going to talk about radiofrequency ablation. We'll talk about nanopulse. We'll talk about all of these different things. There's some really good podcasts. Save Your Thyroid with Jen Holcomb is one of those opportunities. There's a lot of really good content that's out there. The goal of this will be to give you a doctor and a surgeon based amount of content. And then I hope as time goes on to have other experts come on and also to have some additional patients come on so that you can hear the patient perspective. Because one of the things that I hear so much is just the fear that patients have when they start to have a thyroid problem. And you're going to hear this because Jen Holcomb, again, on her Save Your Thyroid podcast, I interviewed her and found that as we were talking, that how much a lot of fear had really been involved in driving some of her decisions. And my goal whenever I sit down and talk with a patient is, how do I help you remove that fear and make how do I help you make the decision that you are going to be grateful for 5 years from now and 10 years from now, instead of just reacting based on emotion right now? And that's hard to do. As soon as, especially, we say the cancer word or we tell you that you need surgery to remove a body part, those are pretty terrifying things. And so the goal of this is to hopefully, in a less scary fashion, kind of dig into some of the science about why doctors say what we say when we talk to you about thyroid surgery or parathyroid surgery, what benefit you might derive from choosing to do that or choosing to take out half of your thyroid. So I like to talk about all of these things. I've got some. We'll go into some of the lectures that I share when I'm with other doctors, as far as why we do certain things that we do and how you can do it safer. And really, just full disclosure, my academic research was always, how can we improve outcomes for our patients, whether that be by getting rid of a scar or making surgery safer or just making it less painful. And so those are the things that I researched while I was in academic medicine at Johns Hopkins. I do still publish. I should mention that I'm the most recent past president of the North American Society for Interventional Thyroidology. That's the group that's focused on non-surgical treatment of thyroid tumors. So like radiofrequency ablation, nanopulse, microwave, all of those things. It's a multidisciplinary group that started during COVID and has already become one of the biggest thermal ablation groups in the entire world. And we've published some great papers in the American Thyroid Journal, Association Journal. So anyways, I'm also the first group of surgeons to formally be recognized as a focused practice surgeon. And so that just means that I spend all of my time doing thyroid and parathyroid, as you know by now. But there's a test that comes out from the American College of Surgeons that if you pass that test and you do a certain number of cases, then you are considered a focused practice thyroid and parathyroid surgeon. So I am the first group of surgeons to receive that accreditation through the American College of Surgeons, the American Head and Neck Society, and the American Association of Endocrine Surgeons. So that's a little bit about me. The next time that we get on, or that you choose to listen to me, you're not going to hear me talk about me. Instead, you'll hear me talk about data and some of the opportunities and things that you might want to consider. And for actually our next show, we're actually going to talk mostly about scarless thyroid surgery, because that is the one thing that I think most patients don't hear from just about anybody else in North America. So I've got a lot of what I share with other doctors when they have questions about it, I'm going to share with patients, hopefully in a patient-friendly way. And that's our plan next time we get together. So thank you for listening, and hopefully this helps you to know who I am, and hopefully it makes you want to listen next time. So thank you.